Welcome everyone and good morning to our first of 3 sessions on patient-centered research. I'm really excited that you could take some time out of your day to be with us and learn about this really important topic. My name is Carly Lovelet and I'm the Manager of Clinical Research for the St. Lawrence Health System. Today, you're also going to be hearing from Jennifer Shaver. Jen is a brilliant and wonderful and passionate woman. She is a registered nurse. She has her Master's of Science in Nursing as well as her Doctorate of Nursing Practice. Jen is a longtime North Country resident, and we have been thrilled to have her on our team for this project. Welcome, Jen. A general overview of patient-centered research and giving some examples of what this research looks like. Although we've been working on this project since before COVID-19 hit, the pandemic has created a new sense of urgency. It served as a global reminder of the importance of research and those patient heroes who volunteer to be a part of these studies. So we hope that you're able to use this information and apply it to your own lives and work, and perhaps you might even use it to collaborate with the research department in the future. This program was developed by St. Lawrence Health System Clinical and Rural Health Research Department in collaboration with the Patients Program of the University of Maryland, Baltimore School of Pharmacy. The members of the Patients Program partner with patients and caregivers to answer questions about the best treatment options to improve health and quality of life. Their subject matter expertise and guidance have been a huge part of our success on this initiative. So after today, we hope that you'll be able to define patient-centered outcomes research, understand how bringing patients and other stakeholders into the research process will benefit the North Country, identify how you can become involved in research, and explain what a patient-centered outcomes research study looks like. As you're going to be learning today, patient-centered research is all about bringing patients to the center of the research process. So to develop this program, we also kept patients at the center of our project. Last year, we formed an interdisciplinary team of patients, past research participants, researchers, healthcare providers, nurses, community members, and healthcare administrators to guide this project forward. This was a huge collaborative effort, and I'd like to thank each and every one of these people for their impact on the project and for the truly enjoyable time that I had working with this group. Outside of our direct group working on this project, some of you in the audience may have taken a survey back in the beginning of the year asking for input on the design of the program. Your feedback helped us tailor the series to the interests and needs of our community. So thank you to any of you who helped shape the project by taking that survey. So on the screen, I have the official definition of patient-centered outcomes research, which is that it helps people and their caregivers communicate and make informed healthcare decisions, allowing their voices to be heard and assessing the value of healthcare options. But let's break this down a bit more. Recognizing that patient-centered outcomes research is a bit of a mouthful, you might see it abbreviated as PCOR. So let's take each word that makes up PCOR one at a time and make sure everyone's on the same page. So first we have patient. And at the root of its meaning, a patient is a person who is in receipt of medical care. Each one of you has likely been a patient at some point, which we did see reflected in our first poll. But what does it mean to be patient-centered? We consider something to be patient-centered if it focuses on and is built around what is important to patients. There's patient-centered care, patient-centered design, and today we are specifically talking about patient-centered research. Outcomes in this context are the measurements that document an impact on the health and well-being of patients. Some commonly used health outcomes include quality of life questionnaires, other patient-reported questionnaires, as well as laboratory values, results on imaging, and pain scores. Research studies will also often check to see if there's a difference in outcomes before and after a treatment decision or a change is made. Lastly, research is a careful investigation designed to uncover information. Research is really all around us and can be applied to anything, but today we'll be specifically focusing on research in healthcare. So let's put it together and create our own definition of PCOR. So in other words, PCOR is when researchers work with patients, caregivers, and other stakeholders to decide what questions are important and the best ways to research those questions and share the results. I wanted to give some background. I'm not going to go into an in-depth history lesson of patient-centered research, but I do feel like it's important to give some context because patient-centered research is not just a nice idea, but it has regulatory backing from multiple different government programs. So, for example, in 1992, the US Congress passed the Patient Drug User Fee Act, and part of this act required the Food and Drug Administration, or the FDA, to add patient voices to the risk-benefit analysis of medical therapy research. Then in 2008, the American Recovery and Reinvestment Act began funding patient-centered comparative effectiveness research to help insurance companies make decisions on which treatments to cover. Lastly, in 2010, the Affordable Care Act was enacted, which funds the Patient-Centered Outcomes Research Institute, which I'm going to tell you about on the next slide. So Patient-Centered Outcomes Research Institute, or PCOR, is an independent nonprofit organization authorized by Congress in 2010. They are committed to continually seeking input from a broad range of stakeholders to guide their work. PCOR's mission is to fund research that will provide patients, their caregivers, and clinicians with the evidence-based information needed to make better informed healthcare decisions. This educational series was funded through a PCOR Eugene Washington Engagement Award, and I have our award number on the slide as well in case you wanted to look up the project on PCOR's website. And with that, I'm going to hand it over to, to Jen to talk about the potential impacts of patient-centered research right here in the North Country.
Thank you, Carly, and thank you everybody else for joining us this morning on this beautiful, beautiful fall day. We'll delve a little bit more into how we feel this is applicable to the North Country. The North Country. It's a huge, huge area. Usually people think of St. Lawrence County. It actually encompasses multiple counties. It's a huge area. I, for one, love our North Country. Many of you, I'm sure, live here because you choose to, not because you have to. We're fully aware of the barriers and challenges of living in the North Country. However, as an example of the perception of those barriers and challenges, I dare say if you talk to anybody in the South about living in the North Country, they may and say transportation is an issue, they're going to think immediately, oh yeah, weather, you guys get snow, you can't travel, there's snow. If you've ever been south and seen how the South handles an inch of snow, you'll realize our North Country does not have a problem with weather. We're very resilient, our roads are plowed, they're taken care of. No, our transportation challenges come in distances we have to travel, the lack of public transportation, things unique to the North Country, hardworking families with one vehicle, and childcare and school issues. So there's multiple unique challenges to living in the North Country that kind of offset the benefit. But again, we choose this. I've always chosen a philosophy of my family, my patients, and my coworkers deserve everything we can possibly lay our hands on. So I absolutely refuse to acknowledge barriers. I refuse to acknowledge barriers of demographics, geography, and any resource that we can lay our hands on, I feel we fully deserve. And so the connection to the North Country, how is this connected to our North Country patient-centered outcomes research? It helps us to better understand our unique area and our North Country populations, because many of you know they're unique even within separate counties, separate communities. Helps patients and providers make more informed decisions, better informed decisions when we're all participating. And ultimately, as the poll pointed out, benefits the health of the North Country. And I'd like to introduce this small vignette that was done by members of my team on the value that we feel patient-centered outcomes research will bring to the North Country.
Our patients' safety and well-being have always been at the center of our mission at the St. Lawrence Health System Clinical Research Department. So developing a defined patient-centered outcomes research program was a necessary next step. To keep it simple, without patient volunteers, there is no research. And without research, there are no new medications and no new knowledge of our communities. By seeking the input and bringing the voice of patients, caregivers, and the community into our research processes, we're making sure that the results of our research are as meaningful as possible to the North Country.
At St. Lawrence Health System, we are committed to putting patients first. We are making strides toward ensuring that everything we do from a research perspective has the patient at the core. That makes sure that we're addressing access for patients, make sure the studies that we're spending our time and resources on are in line with our community and disease states across our region, to ensure that we're having a relevant approach every trial, every day, every initiative that we're working on, that it translates to the patient and the family and the community that we're working for.
Patient-centered outcomes research was a new concept for me that I was introduced to about a year ago when I had the opportunity to work with the clinical research department. And it was quite an exciting concept because it validated everything that I had come to believe in my heart over the past 40 years of being a nurse. And that's how important patients are, the concept of being patient-centered. As a longtime resident of the North Country, I chose to live here and I've chose to practice here. And the community around me is very, very important. The needs of the North Country are unique, as are most places, but in rural New York, there's other barriers like distance, access, and our involvement with this project is going to help close some of those gaps. It's very exciting to think that my small team is going to be able to introduce this topic to community members who are then going to start having those conversations about what they need and helping inform the processes that are going to help meet those needs.
So patient-centered outcomes research, it's about bridging the gap between the community and research goals. It's about partnering with doctors and nurses, healthcare workers, but most importantly, our patients. It's more important now than ever before to have representation from every aspect and member of the community in order to guide the future of healthcare in the North Country. When I sit down with patients, I try to have a conversation and connection about their values and goals in order to paint the larger picture that is the research process.
Patient-centered care is treating every patient the way we would want to be treated, the way we would want our family treated. As a nurse, my job is to provide them with the data that they need to lay it out and figure out how this affects their life and how they want to proceed, how it will affect their family's life. So we empower patients to become active members of their own healthcare team. That's patient-centered care. Research is so important. There's not a medication out there that you or your family take that hasn't gone through the same steps that we're doing right here in rural New York. I have been the beneficiary of medical research with a medication that saved my life. I just feel like it's a great thing to do research and to benefit from it and for others to benefit too. It's a legacy.
Patient-centered outcomes research is research that is driven by patients and which answers the questions that are most important to patients. The reason that doing patient-centered outcomes research in the North Country, in my opinion, is so important is that rural areas like ours have traditionally been underrepresented in research studies. And it's really important not just to have patients asking the questions that are most important to them, but to have rural patients asking the questions that are most important to them so that we can help develop patient-centered outcomes research, not just for our area, but for all rural areas going forward.
Patient-centered outcomes research is important to me because I believe it to be a significant part of St. Lawrence Health System's continuing efforts to improve the quality of healthcare here in the North Country. By providing patients with additional information about their health care, information generated from their collaboration with healthcare providers in research efforts. We will be gaining invaluable data to help us achieve that goal, the goal of improving healthcare here in the North Country.
Our role is to empower patients and respect them as intelligent individuals, to treat them with dignity, allowing them to become independent and respect their privacy and their choices. I think that's how I would want to be treated.
Thank you, Carly. And there will be the contact information that was listed on those, that last slide offered up at the end of this presentation. So, engagement in research. The main goal of patient-centered outcomes research is engagement, and the intent to engage patient, caregivers, and other stakeholders. The whole concept of engagement in patients, to me, is a no-brainer. The people I've worked with that are involved in clinical research in this community, this county, are so engaged. You saw some of them on the video that just played. Very excited, very passionate, very committed. And the opportunity of this project to bring patients into the process just makes that so much more meaningful. Not only participating, but taking a step back and generating the questions and the issues that they want answered, and taking advantage of the scientific expertise that exists in the community right here in our own backyard. There are many ways to engage in research. Anybody can engage in research. There's many levels, from developing a research question, planning a study, which is a little bit more scholarly process, but involving patients in is very, very important. Conducting the study, sharing study results, and participating in a study. And in every one of those stages, there's opportunity now for us to engage patients, community members, and multiple other stakeholders in the process. First step that comes in developing research questions is having a question you want answered, and then helping tailor the question to reflect the patient's voice. I have to share with you that despite being a veteran nurse, okay, just plain old, many years of college, I thought I understood what research was. And I had the most amazing aha moment that was so totally unpredicted. One day I was running late for work, and I had a little bit of a drive, and I used to time my drives so that I didn't get behind a school bus. You want to talk about challenges in rural New York. When you're following a school bus, it adds a little bit to your journey. Well, I decided to make the most of it. The first school bus stop, I watched this little girl leave, who I assume was her mother. It was a parental figure, and absolutely skip and jump and hop to get to the bus. At several points, turning around, waving animatedly, just very, very excited. And at that split second, I thought, wow, I was meant to see this. Just the sheer joy she translated. Watched her get on the bus, and I could even see her through the bus, bopping around, little head moving. And it was just, yeah, it was a nice sight. The next bus stop, a child got on the bus, and it was a totally different situation. This child left the adult he was with, walked to the bus, didn't look back. The woman was on a cell phone. She had a baby in a stroller, and such a total polar opposite of that little girl. And in that split second, I had so many questions. What if I was that teacher? Would I notice the difference between those two children walking into my classroom? And does it make a difference? And does a parent being distracted make a difference? And what about the baby in that stroller? You get the point. There was no shortage after that of things I thought of that I would like to see answered. And I can't even imagine our patients, people that have been receiving care all this time, what kind of questions they have to be answered. So that's the first step. And now I'm going to pass it off to the experts. Carly's going to take over and lead you through the next steps of engagement and planning a study.
Thank you, Jen. And you're way too modest, because I would definitely consider you an expert in research. But once you have a research question which asks a question that patients are interested in, and it's time to plan the study. So part of this is defining the outcomes to measure. Like I said earlier, outcomes are the measurements that document an impact of the health and well-being of patients. And patient-centered outcomes are those measurements that patients are interested in hearing about. So one way of engaging in research is helping us identify those outcomes. And I'll give you an example for some context. So think about a study that wants to research a new treatment for rheumatoid arthritis. The physicians and the researchers designing the study might want to look at the change in C-reactive protein. And this is a blood measure to measure the inflammation in the patient's blood. So the physicians could check the C-reactive protein levels before the patient was treated with the medication. They can then compare that to the levels periodically after the patient starts the treatment to see if the medication is effective in lowering the patient's inflammation. But take a minute and think about the patient's perspective. C-reactive protein levels might not be the top priority for patients with rheumatoid arthritis. Research showing a change in a blood level may not help them decide if they want to take that medication or another one. This is why we need patient-centered outcomes. If we engage patients with rheumatoid arthritis while planning the study, we might find out that they're more interested in learning how the medication might improve their ability to get dressed without pain or to feel more energetic. So at the end of the day, the best study will have a combination of the outcomes that the patients care about, as well as those that the healthcare providers care about, because this will make sure that when the healthcare provider and the patient are making a decision together, that they both are equipped with the information to help them make that informed decision. And in addition to helping define the outcomes of the study, patients and other stakeholders engage in the research process by helping to define the criteria that determine who could be a good fit for the study, so who can actually volunteer to enroll. Another option is helping to define the timeline and the requirements of the study to make sure that the patients would be interested in participating and that participating would fit into their lifestyles. So for example, a study that required patients undergoing chemo to have daily research-specific appointments for several hours is not necessarily taking into account the lifestyles of the patients who might be participating. And lastly, we need patients to provide input on the language used in the informed consent form. And the consent form tells potential participants about the study purpose, the potential risks and benefits of participating. It explains that the study is completely voluntary, and even if they decide to participate, they can always decide to stop participating at any time. And it outlines the timelines and the steps of participating in the study. It's one of the most important steps in research, but scientists can often get caught up in medical jargon and abbreviations, which can be a bit overwhelming for patients trying to learn about the topic for the first time. So having patients and community members give input on the wording and the language of the consent form will ensure that people considering participating in the study will understand it and can make a fully informed decision on if they would like to participate. And results of having engagement at this level is that we have research that answers questions that are interesting and important to those who might participate in the study, that we have research that fits with the lifestyles of participants, and that the study is described in a language that everyone can understand. All right, so we have the question, we designed the study, we got all of the regulatory and ethics approvals we needed, and the next step is actually doing it and conducting the study. And just like every other step up until this point, there are opportunities to engage. So similar to designing the informed consent form language, we also need some input on the design of research recruitment materials and other patient community-facing information. You could also help us with outreach, connecting members of the community together and sharing the opportunity to participate in research studies. There may also be the opportunity to actually help us collect some data, especially if the research involves going into the community and gathering responses to questions. Lastly, you could help us by holding us accountable. We can work together to set goals for engaging with patients and other stakeholders, and you can help us evaluate how we did. And feedback on our engagement will help us to continue to improve as we go through this process more and more. The results of this type of engagement are having access to research materials that are easily understood and an increased collaboration between the research team, clinicians, community, and patients. So once we conduct the study, even if the results are extremely promising and exciting, there'll be no impact on patients or their healthcare providers unless the results are shared effectively. And you can engage in this step by helping us translate the data analysis to written results, help us decide who to share the study results with, help us decide how to share them. So some of these options include paper and online publications, newsletters, presentations, and even word of mouth discussions. And there may also be the opportunity to present the results of the study and help others understand the research and its importance. Results of this type of engagement include making sure the research results are shared with the right people, as well as a greater awareness of the research that is being conducted right here in the North Country. And lastly, perhaps the most obvious way that you can engage in research is by actually volunteering to participate in a study. In our next session of this series, we'll be going into more details about what it looks like to participate on a clinical trial, so stay tuned for that discussion. But if there's not a study out there that fits your needs and interests, then you can always spread the word about study opportunities to those that they may be applicable to. And you can also let us know what types of studies you would be interested in participating in so that we can look for opportunities in the future that might meet your needs. Like you heard me say in that video we watched, without patient volunteers, there is no research. So patients really are the most important part of healthcare research. And by participating in a study, you are helping others in the future, helping advance medicine, and you're contributing to science. And it's pretty exciting that the North Country can make an impact to science and to medicine. You also have a personal benefit by participating in a study by potentially receiving the most cutting-edge treatment. And lastly, by being part of a trial, you receive additional care, support, and medical attention. And most of the time, the study medication, the doctor's visits, imaging, and lab work related to trials are provided at no cost to the patient enrolled. And now I'm going to hand it back to Jen, who's going to tell you a personal story about participating in research.
Thank you, Carly. Carly asked me to share when we were organizing this PowerPoint. We have frequent conversations about being lifelong learners and every moment learning new things. I had quite a different experience this summer. My husband, very unexpectedly, had a major heart attack. And hearts are my jam. That's my thing. Critical care, hearts, the whole 9 yards. And in this age of COVID, for him to be taken literally away from me into an academic medical center where visitation was severely limited, called me when he left the cath lab to tell me his extensive results and translated it in a way that I thought I understood. And at the tail end of that was, and they asked me if I'd like to participate in a research trial, and I said no, because I wanted the best of care. And there was just too much to process at that point. Thankfully, during the 4-hour time visit that I had on the day of his discharge, a nurse practitioner called. She called to talk to him to verify that he did not want to participate in the study. And incidentally, his wife was standing there, so she offered to be on speaker to explain it to us. A whole new world opened up for us, for my husband and for I. We understood suddenly a total different narrative. There was no abandoning what we call usual care. He was still going to get the care he needed. And there were some very exciting possibilities that were being offered that he could participate in. So the short story is my husband opted to participate in the study, and I was allowed to stay in the room for the next 7 hours because our discharge was delayed, where we went through the process of enrolling in the study, his consent process, speaking to 2 different nurse practitioners. And the end result, weekly visits to Syracuse, very vigilant. The whole end result is the fact that these people played such a large role in our care. We understood more about his condition, his procedure, and his future than what we ever could have understood simply from the information we were getting. It was a highly beneficial experience. He's learned as much as I have, and we can't wait to see the results. The only downside is it's a controlled trial. So there's 2 infusions. One is a protein, one is a vitamin, and he's dying to know which one he got. We won't know till the study's close to the end, but we can't wait to share the results of that either. And in fact, I've already talked about it at length with other people we've known. So it was a very, very positive experience. And I would encourage anybody that has the opportunity to participate at any level in research to do so.
I appreciate you sharing, and I appreciate your contribution and your husband's contribution to science. It's really important. I did want to pause again in case anyone had any questions for Jen or myself. And Morella, I see you have your hand raised, so you should be able to unmute yourself now.
Thank you. Good morning. I just want to say that it is great to be a part of this, and much like what Jen was sharing, it's really so important that we participate and engage as patients and as caregivers. I can tell you really quickly our personal story. My 14-year-old son has a juvenile arthritis, and we go to UVM to see our pediatric rheumatologist. And during one of our visits, we were asked if we would participate in a national study for pediatric arthritis patients, juvenile arthritis patients. And you know, it is slightly inconvenient because you have to sit there and, you know, fill out these questionnaires, and he has to respond, you know, my son does, and now he's older, so he can respond himself, you know, and it does, you know, add another 20 or so minutes to our visit. But I feel that it is so important because it is also going to help us and my son in the long term to understand his illness, to understand the remission, you know, to understand the effects and, you know, of medications and things like that. So, you know, if, you know, more data we have, more we collect from more patients is better. And so, you know, like I said, we drive 6 hours, you know, to go there and back. And so another 20 minutes it can be a bit annoying, but I see a great benefit in it. And, you know, I hope that more of us see it that way, you know, as a larger picture and participate. So I'm glad to hear that others are participating as well. Thank you.
Yeah, thank you so much. I really appreciate you sharing that personal story. And I think that's one of the great benefits of developing this research program in the North Country. I mean, clearly we don't have opportunities for every disease, but in the past, before we were here, if you wanted to participate in research, you really did have to drive many, many hours, no matter what kind of opportunity you're looking for. So as we're growing this program, hopefully we have more opportunities for patients like your son who can stay here and receive that care in the comfort of their own homes. Lori, any other comments in the chat box?
Well, Carly, a couple of people have asked what types of research are going on right now in our community?
Yeah, that's a really good question. So the research department, and there's other research outside of the clinical research department here at the St. Lawrence Health System, but we personally do research in a few different areas. So first is the most obvious that most people think of is clinical trials. So we work with different pharmaceutical companies to be activated on their research protocol. So they define which patients are going to qualify for the study. And then we can give these patients access to these treatments that are in the process of getting approved. So we participate in phase 2, 3, and 4 trials. And after phase 3, that's when the pharmaceutical company can submit to the FDA to try to get approval. So every single medication that you see in a pharmacy, this has gone through this process. So by volunteering to participate in a study, you are I don't even want to say small part, you're a large part of getting these medications approved and out there. And it offers you access to the medications before they're even available. So we see in COVID right now that this access on clinical trials has been very important. So we're excited to have a COVID clinical trial program here as well. Outside of the clinical trials investigating new medications, we do also do some investigator-initiated research where we work with our physicians to study topics that they are interested in. So these are often focused on the area that we live in to try to better understand our patient populations, and so that we can close any of the gaps that we see here. So, and then now, since we have this PCOR Engagement Award, we've been learning together as a group about patient-centered research, and this opportunity is going to open up more opportunities to do patient-centered outcomes research specifically. But thank you, Lori. Any other questions that you saw come through?
Someone asked about the additional cost, you know, going to extra doctor's office meetings and traveling. You know, everyone has really been hit hard by COVID. And one person said they didn't think they could afford, you know, to spend the extra money needed to participate in research. Yeah,
that's a very good point as well. So research, most of the time, I won't say always, but if you do participate on a clinical trial, the pharmaceutical company will actually reimburse, will pay for most of the research related procedures. So all of those doctor visits, the actual investigational medication, any imaging, sometimes maintenance medications as well. A lot of the costs associated with research are actually covered completely. So it may end up being cheaper to participate in research than to get care normally. And then on top of that, we do recognize, like Marilla said, that it does take some extra time. Typically, research visits have some additional questionnaires so we can track any side effects, any benefits as the patients participate in the trial, which usually lasts about a year depending on the trial. So we recognize that this is taking extra time out of patients' day, and we do offer compensation, usually around $50 per visit for these patients to compensate them for the time and travel associated with participating in research. So that's also a very good question. Thank you. Alrighty. I don't see any other hands raised, so I'm going to keep on going here. So I wanted to run through a specific example of what research can sometimes look like, kind of similar to the first go around with Jen's husband, and how we can better frame scientific research descriptions to be more patient friendly. So I hope no one on this call is ever in this position, but imagine you contracted COVID-19 and you needed to be hospitalized. COVID is a new disease that we are learning about every day. So the reality is that some of the best options for COVID-19 treatment are experimental medications, often only available through research studies. Now imagine that one day someone comes into your hospital room and drops some documents on your bedside. She lets you know that there is an opportunity to participate in a clinical trial, and she asks you to review the form and just let her know if you're interested in participating. You take a look at the top of the page, and this is what it says. A randomized, double-blind, placebo-controlled, multi-centered study to evaluate the efficacy and safety of drug 123 in hospitalized patients with COVID-19. And I don't know about you, but this title can seem a bit intimidating without someone being there to help explain it and put it in some context. And that sounds like what Jen's husband experienced, just the opportunity bluntly presented, and then he was saying, no, I'm not really interested. So that's what I'm going to do with you today, to give some background and boil this complex mess of words and research terminology into a more easily understandable question. So let's take it piece by piece. First off is randomized. This means that there are at least 2 different treatment groups that you can be assigned to, and this assignment is done by chance, kind of like a flip of the coin. So in this example, there are 2 treatment groups, blue and red, and the patient is randomly assigned to the blue treatment group. Next is double blind, and this means that when the treatment group is assigned, neither the patient or the study team know which group the patient belongs to. And this is to prevent any bias when measuring the outcomes of the trial. And it's important to know that even when a trial is blinded, there is always the option to unblind the doctor in case she needed that information to make a safety or medical decision. Placebo-controlled means that one of the treatment groups will receive a placebo. And a placebo is a substance that has no therapeutic effect. It's sometimes referred to as a sugar pill. So for example, if the study medication is a pill that you take by mouth, the placebo would look exactly like the real drug, but it would not have any active ingredients in it. The placebo group would still get standard treatment and therapy, but they would not get the active medication under study. The placebo is used so that scientists can attribute any change in medical status to the outcome of the treatment and not just random chance. So I'll give you a pretty simple example to illustrate why the placebo is important. If I had a pill that I claimed is guaranteed to relieve a headache, you'd probably want to test my theory. And to do this, you could give one group of people who have headaches the actual pill, and another group of people who have headaches another pill that looks just like it, but does not have any active ingredients in it. Then you could ask the volunteers if they still had headaches after taking the pill. If the same number of people in each group had headaches resolved, then that would suggest that the drug isn't doing much because each group received the same amount of relief. But if 90% of the people who received the drug felt better and 20% of the people who received the placebo felt better, that would indicate that the drug is probably working and having the desired effect. So multi-centered is a pretty easy one. It means that the same clinical trial is offered at multiple locations, often across the nation or even globally. The data gathered from each location is combined in order to have enough information to make conclusions about the drug. So it's kind of exciting because the North Country, the St. Lawrence Health System, is participating in clinical trials that patients have the opportunity to participate in, often across this country, and in many other countries too. So we really are giving the North Country a voice. As Dr. Kadar said in the video, rural research is chronically underrepresented. So we are truly giving a voice to the North Country in medicine. So next, we have efficacy and safety, which are the two goals that we're looking at for this study. And efficacy answers the question, does the drug work? It measures how effective the drug is in treating the disease. But having a therapeutic effect is not the only important consideration when assessing a drug. The potential benefits of the therapy need to outweigh the potential risks. So research also measures safety throughout the process and assesses what types of side effects are experienced, how severe they are, and if they're related to the drug under study. Both safety and efficacy information are judged when the FDA is considering approving the drug for use outside of a clinical trial. And finally, we have the statement of drug 123 in hospitalized patients with COVID-19. So after all of the research lingo, we finally have the meat of the title, which tells us who and what the study is focusing on. In this case, a patient might qualify to enroll in the study of drug 123 if they're hospitalized with COVID-19. So now that we've taken time to go through each part of this title and understand what all of the words mean in the research context, we can frame the study in a way that's easier to understand. The question that our multidisciplinary team came up with is, for patients who are hospitalized with COVID-19, does drug 123 work and is it safe? And how much less intimidating does this sound than the title of the research study? I truly believe that if the hospital worker in my mock example presented the study to the patient framed in this way, the patient would be a lot more likely to take the opportunity to participate more seriously rather than just dismissing it. And this process that I just walked you through is similar to the process that my team and I go through with patients considering a research study with the St. Lawrence Health System. We tell them not only about the trial that they're considering, but also about the research process as a whole, so that they have a complete understanding of the impact of their decision to join or to not join the study. Before I will hand it back over to Jen, I'm going to check to see if there's any questions. Jen, you have the floor.
The next slide we'd like to share with you is a wonderful little vignette about a time that patient-centered outcomes research was employed in a small Kentucky community. And the video tells the story itself, but I do have to share with you that the results of this study, despite the fact it was two years ago conducted, were just shared in the New England Journal of Medicine in September. So when the team shares this PowerPoint with you later after our presentation, you will see the link and references to not only this video that you can watch, but also the journal article, which is really exciting. And in the abstract specifically mentions patient-centered outcomes research. So I thought that was real good validation. So thank you, Carly, for sharing this right now.
The focus of our study was reducing cardiovascular risk factors in people living in Appalachian, Kentucky. And it's a really important topic because people living in that area have the worst cardiovascular risk profile in the United States. Efforts to really decrease or prevent cardiovascular disease in that area are very sporadic and not sustained. And so ours was the first effort to involve individuals in their own, to teach them to do lifestyle changes, to engage in self-care of cardiovascular risk factors, which is the only way to really reduce cardiovascular risk in the long term. And really engage with the community to work on a project that would work in the short term, but in the long term also. We enrolled more than 350 people and randomly assigned them to what's considered usual care, which often actually isn't even practiced in that area because there are so few providers. But the usual care was referral to a primary care provider for care of their cardiovascular risk factors. The intervention group then were a group who received training in self-care of cardiovascular risk factors from community health workers, who in this case were actually nurses who were from the community of interest, who had been engaged in setting up the intervention, who learned everything from us, and who are really well known to people in the community. So we set our study up so that everybody who worked with people in the community was from the community. So it wasn't us, because there's a history of researchers kind of coming into the area and then finishing their project and leaving. And there's a little bit of mistrust because of that. Definitely there was an impact of the intervention, a very positive impact on multiple cardiovascular risk factors, weight, so people decrease their weight, they increase their activity levels, they decrease blood pressure and lipid levels. And actually we had a differential decrease in smoking behavior, which was interesting because we had people pick a goal and only 2 people out of the 350 picked that goal. There's a really strong smoking history and high smoking levels in this area. But I think what happened was that once people saw that they had the skills, that we taught them the skills, and that they could attain other goals, that they did okay with the smoking. So we saw a big difference in that. We are really delighted with the PCOR funding that we received because it really laid the foundation for multiple other studies, multiple funding opportunities in many other conditions, not just cardiovascular disease, many other populations. For example, a prison population, which is really an interesting population to talk about cardiovascular risk factors in. But it really all stemmed from this important work that we did with our PCOR funding to really demonstrate that people in rural areas, people who were living in socioeconomically austere environments could really engage in excellent self-care and wanted to, and would have great outcomes because of it.
Another study that we're just going to speak to, Carly and I, is a case study that's currently underway, and the title of it is Comparing Ways to Help Primary Care Providers Safely Treat Acute Pain and Avoid Overprescribing of Opioids. And designed by patients. Obviously, patient-centered outcomes research is a huge part of this. Treatment groups and outcome measures are spelled out in this slide. And again, it's currently underway. There's no results yet, but when the results are available, they will be published. Carly, is there anything you wanted to add to this one?
No, I did think it was important to highlight that there's a lot of research that does have results, but there is research that's ongoing too. And because we're talking about engaging at every level, we just wanted to give an example of what it looks like to design a study that's patient-centered. And you can see that patients and other stakeholders were involved at the beginning. And if you look at the outcome measures, the 4 different ways of helping providers and nurses to treat acute pain, they're testing the way it affects their pain, whether it limits their ability to do activities, when they're being treated, and how happy they are with their care. And it's clear to me that patients were involved in setting those outcome measures because you can see the patient voice in those outcomes.
Yeah, it springs to mind, there was a question that was asked in the sidebar about, is there a way for our participants or the community to stay updated on what types of studies are being done currently, what topics are being studied, and what results are being noted?
Yeah, thank you for pointing that out. So there is, our research department website does keep an updated list of the trials, the indications that we're currently researching. So I encourage you to take a look at our website. And we did just recently put a section on that website for news. So we've put a couple press releases there, but as we get more results published, that might be an opportunity to share them there. Thanks,
Thank
Jen.
you. And last but not least, a case study that has been completed that compared 2 programs in reducing obesity in Louisiana community through primary care clinics called the PROPEL study. This has been completed. Results have been published in the New England Journal of Medicine. And the study found that an intensive, healthy lifestyle intervention that included coaching embedded in the primary practices that work directly with patients to help develop their own healthy eating habits resulted in patients losing significantly more weight than those that received usual care from their primary clinics. And not only did they lose it, but they kept it off up to 2 years later, which is, you've read about weight loss, is losing weight is the first battle, maintaining the loss is the second. And the results that were demonstrated from this study showed that successful weight loss can be achieved in primary care settings in a highly underserved population who have significant barriers to obtaining healthcare services. And I think that last phrase almost describes our North Country, doesn't it, a little bit? Underserved, significant barriers. So it's kind of an exciting study and a clear example of what can be done when we bring everybody together to address the issue.
Thanks, Jen. And we actually had a pretty hard time picking which studies to share with you, knowing that we had limited time. We chose these 3, thinking that they would relate. But I encourage you to check PCOR's website and browse some of the other patient-centered research studies that have been completed, that are being designed, because this truly is just a very small sampling of some of the great work that's being done. So as we wrap up with the formal presentation here today, I did want to let you know about a specific opportunity that you do have to collaborate with the research department here at St. Lawrence Health System. As part of our project, we'll be forming a focus group of patients, community members, and healthcare representatives to weigh in on our future research. So exactly what we've been talking about this whole time. So if you feel empowered by this conversation and you'd like to become involved in any of the ways that we discussed, I encourage you to reach out to us and reserve your spot on that group. And I have our contact information on the slide, so I'll pause in case you want to write it down or take a picture. And someone did ask earlier if the slides would be available later on, and they will be. So I'll make sure to send them out to all of the participants here today. And lastly, our team will be hosting a series of online COVID-19 education sessions. the first of which will be on October 28th. At this session, Kylie Brugel, Canton-Potsdam Hospital's infectious disease physician assistant, will be presenting on COVID-19 fact versus fiction. She'll be focusing on topics like mask wearing, social distancing, and the safety of going to a doctor's office during the pandemic. We will be offering similar sessions with different guest speakers on a monthly basis, so I hope to see you guys there. And as this is the first part of our 3-part series on patient-centered research, I also encourage you to attend the second 2 sessions of the series on November 11th and December 9th. We'll be diving deeper into more topics, including the research process, engagement principles, and the importance of community involvement in particular. So registration information and a list of upcoming events will be on the Clinical Research Department's webpage, which I have on the screen. So please feel free to reach out directly or visit the webpage and register for those events. So we do have plenty of time for discussion. So I did want to open up to the floor if anyone has any questions. Please feel free to throw them in the chat box or raise your hand and we can unmute you. Questions are welcome, comments, experiences, anything that you'd like to share. And I did get one question privately. So as people think of questions and enter them in the chat box, I will address that one. So someone asked, if we knew of a drug or research study going on, could we be added to that study through your department? Short answer is yes, you can. So as I mentioned before, you can check our website for active studies, or we're a pretty friendly group. So our contact information is on our webpage. So feel free to shoot us an email, give us a call, and we can tell you more about the opportunities that are available. And then we can set up a time to go over that consent form together and make sure you understand what's involved in the study. So absolutely feel free to reach out if there's a study that you're interested in participating in.
Carly?
Yes.
This is Karen Harrington speaking. I have a private comment I just wanted to share. It says, thank you for setting this up. Congratulations on embarking upon this important endeavor. And thank you for bringing it to our communities.
Thank you, Karen. I appreciate you sharing.
Welcome.
And I see that someone's requesting for the link, so I'm just going to throw that in the chat box too, so you guys have a direct link to the webpage that I referenced a few times now. And I see a question in the chat box. Pharmaceutical companies reimbursing patients for cost of participating in clinical trials is great, but what if there's an issue with the patient not having the funds upfront to cover the costs and or their budget very tight for having to wait to be reimbursed? And that's a really good question, and I recognize that I did misspeak a little bit. They don't reimburse the patient. The health system actually fronts that initial cost and we get reimbursed for that cost. So there is no upfront cost involved in a patient participating in most trials, besides the travel and the time, in which case they are getting reimbursed for that, and it does take a couple of weeks. And some studies do recognize that, and they do offer travel and transportation support to try to bridge that gap and really make it accessible to any patient that's interested. Thank you for your question, and I'm sorry if I caused that confusion during my discussion.
Well, I did get a question. Someone asked if they heard of a study, and you touched on this, if they heard of a study that was not being conducted locally, could they join that study through this department? In other words, could this research department reach out to the study to see if we could add patients?
Yeah, so that's also a really good question, and kind of a complex answer, but short answer is we will always try to help connect patients to research opportunities. So one really good resource is clinicaltrials.gov, and that is the registration that any clinical trial is required to register on this site before they enroll any patients. So it has the trial name, some of the main criteria for participating in the trial, and then at the very bottom, it also has the locations that the trial is offered. And there's a couple other websites, I believe Center Watch is another one that does list the locations that trials are being offered so that you can check to see if there's any others near you. And we have, through conversations with patients, connected them to other locations that are offering trials that were not. And we also had one experience where a patient actually reached out to us, said, hey, I have this disease. I'm very interested in participating in a research study. I found this study in particular that I'm interested in participating in. Are you able to offer it here? And we did end up reaching out directly to that company that was offering that trial. And we were going through the process of starting up that trial as we speak. So there's definitely the opportunity to connect patients. And if we're not able to directly participate and conduct that study here, we will try to see if there's an opportunity to participate elsewhere or a different study here. So absolutely. Thank you all. I really appreciate you coming here today, and this was a great conversation. So please do attend our upcoming sessions, and I'll look forward to seeing you guys there. Have a great day.